Good afternoon, everyone. Thank you for joining us for this afternoon's very important webinar. My name is Sam Peck. I am the Executive Director of Family Councils of Ontario, and it is my pleasure to welcome you to this afternoon's Regulation Changes Information Session for residents, families, and caregivers with our guests from the Ministry of Long-Term Care. Before we get into today's content, we start with a land acknowledgement. And we do this because FCO's work and the work of long-term care homes, family councils, family caregivers, policy and decision makers takes place on traditional Indigenous territories across the province we now call Ontario. And on behalf of the FCO team, I'm thankful to be able to live and work on this land. First Nations peoples were the original inhabitants of the land, Canada, and in Ontario alone, there are actually 46 treaties and other agreements. I'm coming to you today from Hamilton, which is situated upon the traditional territories of the Erie, Neutral, Huron-Wendat, Haudenosaunee, and Mississaugas. It's covered by the Dish with One Spoon Wampum Belt Covenant, and that was an agreement between the Haudenosaunee and the Anishinaabeg to share and care for the resources around the Great Lakes. The land's also covered by the Between the Lakes Purchase of 1792, which was between the Crown and the Mississaugas of the Credit First Nation. We are appreciative of the First Nations, Métis, and Inuit people who have cared for these lands since time immemorial, and who continue to contribute to the strength of long-term care homes and communities across the province. Acknowledging the land is an Indigenous protocol that's used to express gratitude to those who reside here and to honor the Indigenous people who have lived and continue to work on this land historically and presently. And it gives us the opportunity to appreciate the unique role and relationship that each of us has with the land, and provides a gentle reminder of the broader perspectives that expand our understanding to encompass the long-standing rich history of the land and our privileged role in residing here. Whether you identify as a descendant of settlers, people who came here against their will, for example, the transatlantic slave trade, perhaps an Indigenous person, you can learn more about the people, territories, and the languages of the land on which you live, work, and care at a great website that is native-land.ca. We're grateful for the opportunity to work across Ontario and to learn more about our shared history, Indigenous presence and land rights, impacts of colonialism, and the harms that have been inflicted on Indigenous people, so that we can establish true reconciliation and meaningful relationships. And we invite you to join in that as well. So a couple of logistics before I hand it over to guest speakers. You are all in listen-only mode, so you can hear us, but we can't hear you. We have protected time today for an interactive Q&A session. Please use the Q&A feature to pose your questions to the ministry guests. We've received a lot of questions in advance, and we'll get to as many questions as possible. But please note that we'll only be able to address the questions that pertain to today's topic. The session is being recorded and will be made available to participants following our time together on our YouTube channel, and the information will be published in our e-bulletin. So now, without further ado, it's my pleasure to introduce the first speaker, Laurie Coleman, Director of the Response Branch. Laurie, over to you.
Thanks very much, Sam. And a good afternoon and a warm welcome to everyone that's joining us today. I want to thank you all for taking the time to join us for today's information session. It's always extremely humbling for us to have an opportunity to connect directly with families and caregivers of residents that are living in long-term care homes across Ontario. We've got some time preserved tomorrow with residents directly, And we always greatly value our time with all of you, both to share information, but also to respond to your questions. My name is Lori Coleman, and I work in the policy division at the Ministry of Long-Term Care. And I'm here today with a number of my colleagues to share information on new changes to the regulation that governs long-term care and to talk about how it will impact residents, families, and caregivers. We've also created, to help support the conversation, an information sheet that will inform residents of what they can expect from the changes that we're talking about today. I really want to extend thanks to everyone at Family Councils Ontario for helping to bring us together today. And really for all of the work that they do. They do such important work representing families and caregivers and in recognizing the really important role that families and caregivers play in supporting residents in long-term care. So on behalf of all of my colleagues and I, thank you very much for helping to coordinate today. We certainly value everyone's perspective that's been able to join the call, and we do want to hear from you. So as Sam mentioned, we've saved lots of time at the back end to work to respond to your questions. And my thanks to everyone who sent questions in advance. We're hoping that we'll be able to address some of those questions in the presentation and then to respond afterwards. So we're going to do our best to answer them and bear with us as we do so. Before we go to the questions, though, we thought we'd take an opportunity to provide an overview of the regulation changes for long-term care and to talk about what these mean for everyone here. So with that, we'll move to the next slide. And we may even just advance right through to the next slide. So on April 11th of just this year, the ministry made some changes to the rules that long-term care homes need to follow. And some of you might recall that at this very time last year, a new law came into effect called the Fixing Long-Term Care Act. And since that time, so since a year ago, we've heard from lots of different areas about how the new rules could be improved to make operations and procedures run more smoothly in long-term care homes. And sometimes that inputs come to us from staff that are working in homes, sometimes from residents themselves, from families and caregivers. Sometimes we get input from professional associations, and all of that is making recommendations in ways that, again, would help to improve the operations and oversight of homes in ways that would ultimately result in better quality of life and quality of care for residents. The regulation changes that took effect last week were really focused in 3 different areas. There were a number of changes in the area of medication management and in particular in the ways that residents safely receive medications. There were a number of changes in the area of staffing and specifically the staffing requirements for some of the positions that are filled in homes. And then lastly, there were some general changes related to resident experience that were targeted to ensure that residents live comfortably in their home. And so with that, we'll move to the next slide. The ministry is committed to ensuring that long-term care residents receive the best possible care and quality of life. And this really means that we're working to make sure that the rules that long-term care homes must follow put resident safety first and support homes to deliver quality care. We know that the needs of residents change over time, and so we always welcome input and suggestions about how we can improve the rules in the future. With support from Family Councils Ontario, we had an opportunity to connect directly with representatives of families and caregivers in some small focus groups earlier this year. And in those, we learned more about medication management in homes. And we also learned about different family and caregiver experiences and observations in how medications are given to residents. These conversations really helped to inform what was included in the changes to the rules that took effect last week and that we're talking about today. Now, on the next slide, we'll talk a little bit here about drug administration in particular, because the ministry is modernizing drug administration requirements so that more health professionals can administer drugs to their full scope of practice. Some of you may recall that before the pandemic, in long-term care homes, only doctors, nurses, and dentists were authorized to administer drugs and medications to long-term care residents. And throughout the pandemic, there were special rules in place that have allowed for greater flexibility in who can administer medication to residents. And in many cases, this has been working really well for homes that had modified their procedures to have personal support workers helping and other healthcare professionals helping to support the administration of drugs. Some of you that are on the line with us today may have gone to your local pharmacy to receive a COVID-19 vaccination or a flu vaccination. And with the change to the rules under the Fixing Long-Term Care Act, pharmacists now can administer COVID-19 and flu shots to residents in long-term care homes as well, not just to people in the community. And in addition, at a home's discretion, personal support workers can administer drugs if they've received training and if they're following certain rules. We're going to talk a lot more about that. So, for example, on the direction of a nurse or a registered practical nurse, with the change in the rules, a personal support worker could assist a resident with eating applesauce that has tablets or medication crushed into it. These changes align with what personal support workers can do in other care settings like retirement homes. There are some really important safety precautions that have been included in the change of rules that specify what a personal support worker can and cannot do. And it's important also to recognize that not all homes will be changing their procedures to leverage personal support workers' support for drug administration. The change in rules does not mean that only personal support workers will administer medication to residents. What it does mean is that homes that do want to include personal support workers in medication administration can, as long as certain rules are followed. We know that already over the past couple of years, some homes have been very successfully utilizing personal support workers to help support medication administration. And they've been working closely with the registered staff to administer medications. But some of the specific rules that I wanted to point out are that personal support workers are not allowed to administer medication if it involves a controlled act. So for example, a personal support worker won't be allowed to give a resident an injection, like an injection of insulin, because injections are a controlled act. Next, I'll just highlight that similar to that, personal support workers are not allowed to administer medications if it's a controlled substance. So controlled substances would include things like opioids and narcotics. A third piece that I'll highlight is that in addition to the training that personal support workers receive in their education programs as they're training to become a personal support worker, homes will need to provide training to personal support workers in addition to updating their medication administration policies and procedures. All of these elements are included to help ensure that resident safety remains focal. And one last piece that I wanted to highlight before we move on to the next slide is that the regulation now requires long-term care homes to offer the COVID-19 vaccine to residents, just like they do the flu shot. And so this doesn't mean that residents have to have the COVID-19 vaccine, but instead it clarifies that homes must offer all residents with opportunity to receive a COVID-19 vaccine if they so choose. And so just a reminder, we're getting to about midway through the presentation today. So if you have questions, please enter them into the Q&A portion of our video conference. And remember that you can click the thumbs up to vote the questions that are of most interest to you. And again, we'll work to get to just as many of them as we can in the end. So there are some additional changes related to medication management that I wanted to highlight. To further bolster resident safety, with every new admission, homes will be required to record in a resident's admission care plan the reason for taking a medication. So what we heard in conversations as we were developing these changes to the rules was that there would be benefit to residents and care providers if it was understood why a resident was taking a particular medication. So for example, aspirin. There can be a lot of reasons why aspirin might be prescribed for someone, but in understanding the reason why can make a difference for how care is provided. So that's now a requirement of the resident's admission care plan to include the reason for taking a medication. It's also required to document any known adverse drug allergies or reactions. And we've also included a change that requires a thorough evaluation of all medications that a resident is taking to ensure the safety and effectiveness of taking them. These changes are really designed to help protect residents by giving clinicians and registered staff at long-term care homes a better understanding of each resident's medication needs as early as possible. We'll move on to a few of the changes with respect to staffing. So over the past few years, the ministry has heard from different homes, from residents, families, professional associations of the need to find ways to ensure that homes have staffing teams that are able to support the very best quality of care for quality of care and life for residents. And we've taken a very close look at any barriers to retaining staff and have made regulation changes that support more flexibility for homes to hire and retain qualified candidates as staff. And that includes, one example is food service workers. So the changes to the regulation have served to enable homes some ongoing flexibility to ensure that they are able to hire, and again, for example, food service workers who meet a number of criteria and who have a wealth of experience across different sectors. And these changes are really intended to help balance staffing flexibility needs for homes while maintaining resident safety and quality of life. The next area I wanted to highlight in our overview relates more broadly to a resident's experience, and in particular with respect to post-fall assessments and skin and wound care. So there were some changes in the rules in those specific areas. Homes are now required to always complete a post-fall assessment when a resident falls. In the language in the rules before, there was some discretion around whether or not an assessment needed to be completed, but the rules have been updated to require that every time there's a fall of a resident, that a post-falls assessment is completed. There was also changes with respect to when a registered dietitian would respond with take a look at sort of nutrition intervention, and residents will now be assessed by a registered dietitian if they exhibit a skin condition that's likely to respond to nutrition intervention. And these changes, similar to the changes in the area of medication management, are really intended to protect resident health and safety and provide greater clarity to long-term care homes regarding best practices. We'll move to the next slide now. Thanks, Malika. While the vast majority of homes across Ontario now are provisioned with air conditioning in resident rooms, to enhance the resident experience and ensure that homes continue to be accountable, the ministry is introducing a new penalty of $25,000 for homes that fail to have air conditioning in every resident room and designated cooling area from May 15th to September 15th of each year. The regulation changes also make it clear the type of air conditioning systems that homes are permitted to install. And the regulation is now clarifying when homes are permitted to remove portable or window air conditioners with respect to resident preferences. So there were a number of questions over the course of the past year on whether or not homes could, for example, remove a portable air conditioner from a window in the colder months and still be compliant with the rules that they have to follow. And these changes are serving to make this more clear for everyone. And moving on to our last topic, the ministry made some changes to the regulation to clarify rules regarding alternate level of care placements, or ALC. And alternate level of care patients are those who are in hospital, but where their care team has indicated that there would be another setting that would better meet the needs of that patient. And sometimes that other setting is identified as long-term care. And the regulation changes at this time make clear that a placement coordinator can place an alternate level of care patient who has only requested to move to a basic room into a private or semi-private room, but at the basic rate. And so these changes have really clarified that a resident who was an alternate level of care patient in a hospital and where they have been moved into a private or semi-private room can only be asked to pay the preferred rate if they choose to stay in that room or if they refuse an offer to transfer to a basic to a basic room. So we'll move to the next slide, which really is coming to the conclusion before we move into question and answers. So certainly, as we move forward, the ministry will be working hard to continue to update residents, families, and caregivers on the status of regulation development activities, and we'll be continuing to consult with our key partners as we think about the rules in the future and consider how we can continue to improve. So with that, that's the end of our formal presentation, and we've got an opportunity now for questions and answers. And so if you can bear with me a moment, I'll just see which question we're going to first. All right. And again, I mentioned earlier that I've got some colleagues on the line who've joined me who are going to help to answer the questions that you've raised today. And so with that, and I'll ask my colleagues to just introduce themselves as they come onto the line for the first time. And so the first question today is for my colleague Amanda, and it relates to staffing. So Amanda, what does flexibility to hire and retain staff mean?
Great, thanks, Lori. And my name is Amanda Bain. I'm the director of the Strategic Initiatives Branch here at the Ministry of Long-Term Care. So when we're talking about flexibility to hire and retain staff, what we're really focused on here is making sure that the staffing qualifications for the roles within long-term care homes that are specified in regulation, making sure that those qualifications are proportionate with the responsibilities and accountabilities of the role, while ensuring that, resident quality of care and safety won't be impacted. So with these amendments, the intention of the flexibility changes is really to allow long-term care homes to have an expanded pool of people that they can hire given some of the staffing challenges that we know long-term care homes are experiencing right now in the province. So I can give two very specific examples that might bring this to light a little bit for folks so that you have a better understanding of what we're talking about. When we think about food service workers and cooks, for example, the previous iteration of the regulation did require the completion of specific post-secondary degrees in terms of training or certificates. And we heard clearly from homes that this was really preventing them from being able to hire highly qualified individuals who maybe didn't have that specific educational training completed or were in progress. So for example, folks who had worked in the hospitality industry for many years, who had, a lot of really great specific restaurant and cooking experience, or who had experience working in other institutional food settings, were sometimes being screened out from being able to be hired into these roles, despite having the necessary skills and experience to do them. So the regulation was amended. We've still indicated and maintained in there, the listing of some of those post-secondary education and training requirements that would be great for homes to look for, but we are allowing them the flexibility to hire if they find that an individual has the necessary skills, experience, and training in order to fulfill the role. Another example of this is related to the designated leads for housekeeping, laundry, and maintenance. So previously we required a post-secondary education for that. And now this has been changed instead to focus on ensuring that whoever the home would be hiring into any of those designated lead roles has the necessary skills, training, and experience in order to fulfill that role. And we've also added in a note in regulation that they should have knowledge of evidence-based best practices, as well as that leadership experience, which for those lead positions was deemed to be really important. So those are just a few examples of some of the changes that are included relating to staffing qualifications that are really intended to allow homes some greater flexibility in filling these really important roles in the home without impacting negatively on resident quality of care. Thanks, Lori.
Thank you, Amanda. All right, the next question is, what if we don't want a PSW to administer drugs to our resident or family member? And I'm happy to respond to that one directly, because this is an area where we've been having lots of dialogue around what supports we can put in place to build consistency across the province and to help support homes with implementation. So again, a piece that I wanted to highlight is that the change in the rules doesn't mean that PSWs will be administering drugs in every home across Ontario. It means it's an enabling provision that provides homes with an opportunity to update their policies and their procedures with respect to medication administration to include personal support workers in providing support for that function within the home. If an individual, a resident, or a family member doesn't want a personal support worker administering drugs, I think that's a piece that homes would have a conversation in the context of a care plan for the resident with the home where that person resides. And another piece that I forgot to highlight in my delivery earlier is that the ministry is developing a guideline for homes that we anticipate releasing later or early in May. And that's going to provide some direction for homes in how they can consider training for personal support workers should they choose to leverage personal support workers to support drug administration within their homes. I hope that answered the question. I'm going to move on to the next one, but again, keep the questions coming in through the Q&A feature in the Zoom call, and we're again going to do our best to respond to them. The next question is, I'll ask my colleague Carol if she's able to respond to what are the qualification requirements for personal support workers?
Hi, Lori. Thanks so much for the question, and thanks for the invitation and the chance to present today. So the primary qualification for a personal support worker in long-term care is that they have graduated from a PSW program, so either they've either a certificate or a diploma that has been developed to meet the program standard that is developed by the Ministry of Colleges and Universities. To explain that a bit more, the Ministry of Colleges and Universities has a very robust process that they go through to develop a program standard in the case where it isn't an already regulated profession. And so whether a PSW student is taking their program through a district school board, through one of the 27 public colleges, or through a private career college, all of those programs are required to be delivered and developed in alignment with that standard. And that is the most important requirement for a PSW. There are a few grandfathering provisions for individuals that have been in the profession for some time, but I think that's the key qualification requirement that I'd like to highlight.
Thank you, Carol. All right, we'll move on to the next question, which reads, PSWs are already overwhelmed with resident care workload, struggling to meet basic needs. How will adding the administration of medication help residents or staff? I'm happy to field that one as well, because I think we continue to hear concerns through the media, through conversations about health human resource demands, not only in long-term care, but right across our entire healthcare sector. And the changes to the rules that we've made at this stage with respect to medication management is again intended to help homes to leverage the entire care team, and certainly for health professionals, the opportunity for them to serve at their full scope of practice. And so what we're hoping is that enabling homes to build their medication administration procedures and policies in a way that makes sense and meets the needs of that particular home will help homes with the opportunity to deploy their resources in a way that best meets the needs of the residents living in that particular home. So thank you for the question. The next question, I'll ask my colleague Anita to join because this question pertains to air conditioning. And Anita, the question is, what temperature does a resident's room need to be set to? And can it be controlled and adjusted to their preferences?
Thank you very much for the question, and thanks for having me. My name is Anita Hooper, and I am the Director of the Operational Policy and Implementation Branch in Ministry's Operations Division. So there are a couple of components here. So the regulation does not specify a maximum temperature that homes need to maintain. So different parts of the home have different cooling needs. So for example, a kitchen might need to be kept cooler than a resident bedroom might need to be. The regulation does require that the air conditioning maintain the temperature at a comfortable level for residents. And this is going to vary based on resident preference and needs. So nothing is outlined at a specific temperature, but it needs to be done in a resident bedroom based on preference and needs of the resident. So something to keep in mind as well is that the type of air conditioning system in a home is going to vary. So some central air systems have in-room controls, while others might be controlled for a group of resident rooms. Portable and window air conditioning units can be controlled directly in the bedroom. And then in terms of, I'm going to go a little bit further here, changing temperature in any circumstance where you have more than one resident sharing a room, both residents' needs and preferences need to be considered when changing temperature in that room. So I think I have answered the components of that question. So thanks, Lori. All
right. The next question's got multiple parts to it, and it circles back to personal support workers and administration of drugs. So the question is, personal support workers are already overwhelmed with resident care workload, struggling to meet basic needs. How will adding the administration of medication help residents or staff? Why are the changes to upload more responsibilities to personal support workers? And what will happen if a mistake happens? And so I'll give a couple of examples of where it may be beneficial to have personal support workers providing support with respect to drug administration. So Some medications, particularly topicals, can be applied at the time that a resident is getting dressed. And from an operational perspective, having rules in place that can help support that by a personal support worker and a resident, where the relationship may be very known and positive, can be beneficial for the resident. And similarly, with respect to some medications that are administered by being crushed into food, this allows the opportunity for personal support workers who may already be assisting at meal times to administer medication to residents, and particularly beneficial where a resident may be more comfortable with a personal support worker. Now, the question around what happens if a mistake happens, that's an important question. And all homes have to have policies and procedures in place when there is a critical incident that includes errors with respect to medications. And those same policies and procedures will need to be followed if there's a mistake, if that mistake in medication administration involves a personal support worker. And homes have they go through quarterly processes of taking a look at incidents that have occurred within the home to determine if there's ways to improve their procedures and processes. So that will continue to be in place for homes and help as sort of a bit of a check and balance to make sure that if a home has altered their procedures and policies, that they're doing so in a way that is beneficial for residents. Now, the next question, it'll be directed to my colleague, Andre. And Andre, the question is, many residents' conditions would benefit from a registered dietitian's assessment. Why do you specify only skin condition? Can a dietitian help a resident who wants to reduce their calories?
Thanks, Lori, and thanks everyone for having us here today and for the question. My name is Andre Trevisan. I'm a manager in the policy division here at Long-Term Care. So this is a multi-part question. I'm going to first say in terms of a registered dietitian that every home has to ensure that there's a registered dietitian for the home. They need to provide at least 30 minutes per resident per month to carry out clinical and nutritional care duties. So that encompasses a whole scope of things, like obviously looking at the diets of the residents and how that's impacting their health. In terms of why it's only skin condition is mentioned, that's because that is actually in the section of the regulation that's about skin and wound care. So that change was meant to clarify that registered dietitians should only be looking at conditions that would likely be improved through some sort of nutritional intervention. It doesn't preclude it doesn't preclude the dietitian and the plan of care from changing for other things that the resident may be experiencing. And then lastly, on the aspect about helping a resident who wants to reduce their calories, again, this is something that the resident and their caregiver and their family should speak to with their health professional to figure out what is the best way to make changes to their plan of care, and seeing if that would include also changes to their diet to sort of meet whatever goals of the resident. So I hope that answers the question.
Thank you, Andre. All right, the next question. Is there a concrete list of medications that will be administered by personal support workers, either from the provincial government or another entity? And so I'll highlight a couple of pieces here. So again, personal support workers won't necessarily be administering drugs in all long-term care homes across the province. So each home will determine the policy and procedure that works best in their home. With regards to a list of medications, there is a list of medications that are controlled. So controlled substances. It's a very long list, and it's set out under a federal piece of legislation, the Controlled Substances Act. And it includes the list of controlled substances that personal support workers will not be authorized to administer. And I hope that answers that question. The next one moves back into staffing. And so Amanda, why were staffing qualifications revised? And how will the new staffing qualifications help to retain staff?
Thanks, Lori. So in terms of the staffing qualifications, and I've been following the chat, and I just want to make clear what I'm talking to relating to staffing qualifications is separate from what Lori's been discussing relating to PSW medication management. The staffing qualifications piece is really about who can be allowed to be hired into the role and what are the requirements for that. So I just wanted to make that clarification. The staffing qualifications piece here that I'm discussing is separate from that. In terms of why the qualifications were revised for the roles that were included in the regulatory changes, we did speak to a number of stakeholders who communicated a need for some ongoing staffing flexibility and for some new solutions that could help address the staffing challenges in long-term care homes. These have really been exacerbated by COVID-19, and so homes are really struggling to fill some of these more sort of supportive roles in the home. We did conduct some really thorough and informative consultations with some key internal and external partners, including with the public, in order to inform the development of these changes. And really, in terms of the why, we were focused on making sure that the staffing roles and the requirements associated with them were proportionate with the responsibilities and accountabilities of those roles without impacting on resident quality of care. So that was really the focus and kind of the impetus for making these changes. And also, we were really hoping to eliminate some barriers that homes were facing in hiring qualified individuals. And it was really keeping some of these people out of the long-term care sector to pursue a rewarding career. So these changes are really intended to support homes in delivering quality of care and to make sure that they have a broader pool of qualified individuals in order to perform the roles associated with those tasks. Thanks, Lori.
All right, the next question is, how will nurses delegate the act of dispensing medications? The College of Nurses has a standard that they've established for nurses in working with unregulated health professionals. And that standard will apply to the relationship between nursing staff and personal support workers with respect to administration of medications. Nurses will still be responsible for dispensing, for setting up the medications for administration. And in accordance with the standard that's established by the College of Nurses, they'll work with personal support staff where homes have leveraged that piece of the rules to have personal support workers administering medications to residents. Now, the next question is for Carol, and it's about personal support workers. So Carol, is there a plan to increase personal support workers in long-term care?
Yes, there is. Thanks so much for the question. So over the last 2 years, the government's made significant investments to educate and train personal support workers, over $200 million, which is resulting in 24,000 personal support workers will be trained by the end of 2023. Now those are individuals graduating and starting work in the broader healthcare system, trained through public colleges, private career colleges, and district school boards. We will continue to build on these investments with a tighter focus on recruiting and retaining those new graduates into long-term care. And so we'll be hoping to announce some new investments in the coming weeks. Thank you.
Thanks, Carol. The next question is, what consultation did government undertake with the Registered Nurses Association of Ontario and others, if any? I would say since the fall, and particularly with respect to medication management and drug administration, the ministry has been engaged in a number of different consultation conversations with stakeholders across long-term care. And that's included one-on-one conversations with professional associations, the regulatory college, some of the regulatory colleges that govern the regulated health professions in Ontario, professional associations. We've spoken to a number of long-term care homes and have also gotten advice through a technical advisory table to the ministry that's comprised of representatives from a number of different homes, as well as associations. And so, and I think I mentioned earlier that we also had some focus groups that Family Councils Ontario, as well as Ontario Residents Association, helped us to coordinate and facilitate to get family, caregiver, and resident perspective directly. We also had a proposal of a summary of the proposed changes that was posted to Ontario's regulatory registry in February of this year. And that really, the combination of those things really formed the consultation for us in development of changes, particularly with respect to medication management. There's been other consultation tables where we've received input with respect to staffing qualifications. But I would highlight that we do consider it to be an ongoing conversation. And so you'll see on your screen contact information for the ministry. We're always open and receptive to feedback and input that people have with respect to how we can make things better in the future. So that consultation will be ongoing. The next question is back to air conditioning. So Anita, what happens if there's not air conditioning in a resident's room?
Okay, thank you, Lori. So there are a couple of things. There is a new provision in the regulation that allows, in some circumstances, for a resident to have their portable or window air conditioning unit removed. But in the circumstance where they, in fact, want air conditioning, so all long-term care homes are required to have air conditioning in resident bedrooms. So that came into effect last summer. There are some circumstances where a handful of homes may not have air conditioning by this summer season. And there are limited circumstances where they can have exemptions for reasons that they, not to have air conditioning, but we expect that it will be about 5 homes. But for every other home, they are required to have air conditioning. And if they are found not to have air conditioning and do not have an exemption, they can be issued an administrative monetary penalty, or an AMP, for $25,000. It's a very significant penalty. So that's for failure to comply with the requirements, and an order is issued for failure to comply, and they will, that AMP of $25,000 will be imposed. Any subsequent orders for failure to comply with the requirement would increase. So if a home doesn't comply, the second failure would be $50,000, and then it would go up by $25,000 after that. So that is the change in this current regulation, is that new AMP amount.
Thanks, Anita.
Sorry.
The next question is about personal support workers, and it reads, if changes are such that personal support workers must be authorized by a member of the registered nursing staff to administer medications, what will this entail? And each home across Ontario is required to develop policies and procedures to guide their medication management processes, and that includes medication administration in the home. And the other piece that will govern this work, it relates to the College of Nurses standard that they have established with respect to nurses working with unregulated health professionals, and that includes personal support workers. So the policies and procedures for each home will need to be documented, and they may look a little bit different from home to home, but they'll all adhere to the requirements that are set out in the standard that's established for the College of Nurses in how nurses work with unregulated staff. Now, the next question is for Amanda. And the question is, will more nurses and PSWs be hired to take care of residents?
Thanks, Lori. So, it's no surprise to anybody that's on this call that, the health and long-term care sectors are experiencing some ongoing staffing challenges. I can say that the Ministry of Long-Term Care is working closely with all of our partners to implement several staffing initiatives that are part of our multi-year staffing plan that was announced in December 2020. And they're really focused on addressing some of the longstanding and systemic challenges relating to staffing in the long-term care sector, which were really highlighted and exacerbated by COVID-19. So very specifically, we do have a focus on increasing the supply and retention of qualified staff in long-term care. In the law that Lori mentioned that came into effect around this time last year, the Fixing Long-Term Care Act, there are some actual legislative requirements that set out progressive targets for the province in terms of the number of hours and minutes of direct care that are provided to residents in long-term care homes. So there's one target for nurses and PSWs, and then there's another target for allied health professionals, which are the other healthcare staff that are working directly with residents in homes. And really the goal of these targets is to make sure that residents are getting more hands-on care. To support the homes in being able to meet these targets and to increase that direct hours of care. There was an announcement just a few weeks ago that homes will be receiving up to $1.25 billion this year and 1.8 next year in order to support hiring and retaining direct care staff. So this funding is really intended to help the homes meet those targets and increase the amount of direct care. But beyond that, we do know how important it is to increase the actual supply of individuals that are coming to work in the long-term care home sector. And as Carol alluded to in her previous response, we have, as a ministry, invested millions of dollars in the training and education of new PSWs and nurses. And we're also really working hard on building that sector capacity for students to do their clinical placements in long-term care to make sure that they've got that experience and they sort of see long-term care as a viable career path. So there's lots of activity where we are very focused on increasing staffing in long-term care homes. And there are a lot of initiatives underway. Back to you, Lori.
Thanks, Amanda. The next question is, will medications be written in the care plan? For example, a resident takes nitro for chest pain. And one of the new changes to the rules does require that homes will need to record in a resident's admission care plan the reason for taking a medication. So it'll need to include the medications and the reason for it. And certainly what we heard is that including the specification about why a resident is taking a medication can help the care team make sure that the care is being provided in an effective way. All right. Amanda, I hope you didn't go too far because the next question's coming back to you, Amanda. Are qualification requirements for recreation staff changing? What about requirements for on-site physiotherapist and assistant physio qualifications?
Thanks, Lori. I'm still here. So yes, we have made some changes for recreation and social activity staff. We did make some more technical changes to the grandparenting provisions that are in the regulation. But the material changes that I can summarize for you are as follows. There are two types of staffing positions that are in regulation relating to rec and social. One is the designated lead, and the other is for staff. So for the designated lead for recreation and social activities, what we've done is we've maintained the requirement to have a post-secondary education in order to be hired into the role, but we've added gerontology to the list of fields of study that could make you eligible for hire. And we also removed a previous reference that said the individual needed at least 1 year of experience. And instead, we just say that they must have acceptable experience based on the home's judgment. And we've included the definition to say, if you have experience in a relevant setting, in addition to a healthcare setting, you could be considered for the role. For staff providing recreational and social activities, we still reference the post-secondary requirement, but we've also added in that individuals for the staff roles here could be hired if they have the appropriate skill, knowledge, and experience, even if they don't have the post-secondary requirement. I think part of the question was related to physios. So there are the staffing qualifications for physiotherapists and assistant physios aren't described in regulations, so there were no changes that were made. The requirement right now is that homes must ensure that there's therapy for residents, including physio on site, and that was not amended at all during this suite of changes. Back to you, Lori.
All right, thanks, Amanda. And time goes by extremely quickly. We're coming up against the 3 o'clock mark here. And so I did want to just provide a few closing comments. First, to thank you so much for coming and for keeping the questions coming. I hope that you found the information to be helpful, but we certainly value your time today. Your opinions and your voices really do matter to us. We are listening, and we hope to continue this collaboration as we continue to evolve and refine the rules that long-term care homes have to follow across Ontario to make sure that residents receive the very best quality of care. Again, I want to extend sincere thanks to Family Councils Ontario for helping to coordinate today. It's been extremely helpful to us. And I want to thank you all for your time. There's an email that you'll see on the screen right now, and it's mltc.correspondence@ontario.ca. And I would certainly invite anyone to send in comments for us, for feedback, questions that you may have. And we'll certainly look to get responses out to you just as soon as we can. So I thank everyone for their time today. And Sam, I'm going to pass it back to you for a final closeout.
Right. Thank you so much, Lori and team, for the presentation, for sharing this information with us all. We've had over 500 people log on to this afternoon's session, and that's a testament to how much people care about these regulatory changes and the quality of life and experience of residents living in long-term care across Ontario. So I know we couldn't get to all of the questions that were submitted today. We got to as many as possible. So I do strongly encourage you, if you do have a question still about the content of today's session, about the changes and updates to the regulations, the legislation, or other parts of the long-term care system, please do reach out to the ministry at the email address noted there. As Lori said, mltc.correspondence@ontario.ca. So once again, thank you for joining us for the regulations update information session, originally held on April 17th, 2023. Again, my name is Sam Peck. I'm with Family Councils of Ontario. You can also reach out to us at info@fco.ngo, and we'll help you as best we can, particularly with questions and queries regarding family councils. So please do reach out. But until then, thank you again for joining us. Thank you to ministry and team for presentation today, the behind the scenes support, and your time to communicate directly to caregivers. Until then, take care, be well, and we hope to hear from you all soon. Thank you, everyone.